If you have diabetes or depression, medication might be part of your treatment. But for people suffering from alcohol abuse disorder, medication is rarely prescribed. Ali Rogan reports on the potential that medication holds for treating this disease and why it's underused.
Nearly 30 million Americans struggle with alcohol addiction, and the problem has steadily gotten worse, accelerating since the pandemic began. Yet less than 5% of people reported getting treatment of any kind. But drugs used to treat alcohol use disorder have been on the market for decades, and more are currently being studied. Dr. Sarah Wakeman runs the Substance Use Disorder Initiative at Massachusetts General Hospital Brigham. Thank you so much, Dr. Wakeman, for joining us. First of all, let's talk about how the medical community defines alcohol use disorder, and also what have the trend lines been? Has the problem gotten more prevalent since the pandemic began?
The definition of alcohol use disorder is compulsively using alcohol despite problems. And so those can be problems in your life, like in your relationships or your ability to work or carry out your functions, or in your health. So continuing to use alcohol despite known health, either mental or physical health problems that are exacerbated by use. So like many health conditions and many areas of substance use disorder, we've seen worsening trends since the onset of the pandemic. And this is true both for heavy drinking and also alcohol use disorder and health conditions related to alcohol use. One of the most scary trends we've seen actually soon after the pandemic hit, we saw an increase in alcohol-related mortality, which was largely driven by liver disease or liver failure from heavy alcohol use.
And people might not be so aware that medication is available to address alcohol use disorder. How has medication been used historically in the United States?
It's vastly underutilized. So you talked about in your opening, we have millions of people who meet criteria for alcohol use disorder. Fewer than 8% really access treatment in a given year. And of those, less than 2% of people access treatment with medications. And there's lots of reasons for that, but it is one area of medicine that really doesn't make its way to people who need it most.
Can you tell us about the drugs that are already available to treat alcohol use disorder, and why aren't they prescribed more readily here?
So there are 3 FDA-approved medications available in the US for treatment of alcohol use disorder. There's also other medications that are off-label or not officially approved for that indication, but are very effective. And these medicines, for the most part, work by reducing the urge to want to drink and the pleasurable feedback that you get from drinking. And so they can be really powerful and have been shown to help reduce heavy drinking days and also to improve the likelihood that someone can achieve abstinence, meaning not drinking at all. I think many people aren't even aware that there are medications they could ask their doctor for, or that could be a part of their treatment. And you have to remember, as a society, for more than 100 years, we've really carved addiction out as something separate from the rest of our healthcare system, or somehow different than the rest of medical care and medical conditions that we treat. And so there's been this idea that addiction, although we sometimes say it's an illness, many of our policies and our clinical procedures really approach it like it's an issue of morality or willpower. And so really undoing that ideology, those general stigmatizing notions, is really important to bring addiction back into the medical system, back into medical training, so that doctors and nurses and other healthcare professionals feel comfortable addressing this and offer medication treatment just like they would for depression or diabetes or heart disease.
What about elsewhere in the developed world? How is medication used in other parts of the world?
Medications used much more commonly, for example, in Europe, where there's even a method of using medication as needed to reduce heavy drinking. So if you know that when you go to a cocktail party or around holidays or during times of stress, you're more likely to drink heavily or at a level above what you want to be drinking for your health or life goals, you can actually take a medicine before that, and it's been shown to help reduce heavy drinking.
There's been increased attention on diabetes drugs like Ozempic, that they have been shown to reduce symptoms of alcohol use disorder. What is the potential there, and also what are some concerns around the use of these drugs for that purpose?
I think it's really exciting. We obviously need to utilize the medications we have in existence, but we always need more innovation and better medication and more options for patients. The early studies, both sort of anecdotes about people who've taken these medications and found that their craving or urge to want to drink have diminished, are really promising. There's also some animal studies in mice showing reduction in alcohol use and alcohol seeking behaviors. Obviously, there need to be clinical trials that show that this is effective and that it gets to the right clinical endpoints, and that would require funding and research. And so usually that takes on the order of years for those kind of approvals to happen. I think that can sound like a long time, but in the meantime, we have effective medications that exist that are easy to prescribe, that any doctor can prescribe. And so really encouraging people people who are listening, if you're struggling, if a family member's struggling, you could talk to your doctor. This could be one component of lots of different types of treatments that are available for alcohol use disorder.
And lastly, let's talk about when should someone reach out for help seeking treatment or otherwise addressing an alcohol use disorder?
I think if you're worried about your alcohol use, if someone in your life is worried about it, those are probably the two best predictors. If you're having health related consequences from your alcohol use, like liver problems, even feeling hungover, having any times like a blackout, you don't remember what happened, those are all really worrisome symptoms that alcohol is playing a role in your life that could begin causing problems. I think many people don't know about the lower level drinking limits that we think of when we talk about lower risk drinking. It's really no more than 7 drinks a week for a woman or anyone over 65, and no more than 14 drinks a week for a man who's under 65. I think if you try to make changes to your alcohol use to get it to a healthier level and you find it's hard to cut back or hard to make changes, that sometimes can be an indication that things may have gotten out of your control. And it's never a wrong thing to talk to someone or ask for help, because the earlier we can provide support, the earlier we can intervene, the better someone will do.
Dr. Sarah Wakeman with Massachusetts General Hospital Brigham, thank you so much for talking about this important issue.
Thanks for having me.